Will I still be a man after prostate surgery? This silent fear keeps many men awake at night. And it is not just the men. Their partners lie next to them, silently worrying about their future intimacy. The stress of this unknown is heavy. Chronic stress increases the risk of depression by 40% according to Psychoneuroendocrinology's site 1. But the medical truth is much brighter than your fears. Today, we are turning on the lights. Meet your prostate. It is a cute, hard-working little walnut-sized gland sitting quietly right below your bladder. Its main job is not creating your masculinity. It simply produces the fluid that nourishes and transports your sperm. However, as you age, this little guy can grow, squeezing the tube you urinate through, causing endless bathroom trips. Or, in more serious cases, it can develop malignant cells. Prostate cancer is the number 2 cancer in men according to the ACS site 1. When surgery is recommended, the immediate panic is about losing erections, orgasms, and sexual desire completely. Here is the secret. Your desire, your libido, starts right here in your brain, not in your prostate. And the hormone that drives that desire, testosterone, is produced safely in your testicles, which remain completely untouched. This means your fundamental identity and drive as a man do not disappear when the prostate is treated. You will still crave intimacy, closeness, and the warm connection with your partner just as much as before. However, the mechanical plumbing does change. Different surgeries affect your ejaculation and erections in very different ways. Let us dive into the 3 main types of prostate surgery, starting with the gentlest one, the water vapor therapy. To understand sex after surgery, we must separate desire from mechanics. Libido is a neurological and hormonal cocktail. More than 95% of your testosterone is produced in the testicles site 1. This factory is completely untouched. Your prostate merely provides the transportation fluid, so losing it does not delete your inner drive or masculine identity. However, erections rely on a delicate web of nerves. Let us meet the cavernous nerve bundle. These tiny, fragile yellow cables act like electrical wires, sending signals to blood vessels to dilate and expand. When the signal arrives, blood rushes in, creating a hydraulic effect. It is pure neurobiology meeting fluid dynamics. The problem? These microscopic nerves literally hug the outer capsule of the prostate like a tight, sticky spiderweb. During surgery, the doctor must carefully peel these delicate nerves off the gland to save them. It requires extreme precision. If a tumor is aggressive, or if chronic inflammation has glued everything together, saving the nerve might be impossible. Even when perfectly spared, these nerves suffer from surgical shock, temporarily falling asleep and halting your natural erection process. Do not panic if nothing happens immediately. Nerve recovery can take anywhere from 12 to 24 months. But here is the most surprising fact. You can still experience a climax and orgasm without a prostate. Orgasms are controlled by the brain commanding your pelvic floor muscles to contract rhythmically, independent of the prostate. The result is a dry orgasm. The intense, pleasurable sensation remains exactly the same, but no fluid is released. This new normal can be wonderful, but how much damage occurs depends entirely on which specific surgical method is used. Let us start with benign or non-cancerous prostate enlargement, widely known in medicine as BPH. For BPH, the gentlest option available is water vapor therapy. Think of it as a localized spa. Doctors inject sterile, hot water vapor directly into the overgrown tissue, causing it to gradually shrink away. This method slowly opens the blocked channel over a few weeks without cutting or removing any tissue. The greatest advantage? 97% of men fully retain their normal ejaculation after this specific procedure, site 1. For these men, both the firmness of their erections and the physical orgasms remain exactly as before. However, it is not a magic fix. Pre-existing erection issues will not disappear after the surgery either. Now, what if your prostate is severely blocking the flow and you need immediate, drastic plumbing relief? If a patient relies on a catheter, doctors often choose the classic TURP procedure to clear it. Using a highly specialized electrical loop, the surgeon actively shaves away the excess inner prostate tissue. Imagine taking an ice cream scoop to the center of a melon, creating a wide, clear tunnel. This surgery provides brilliant, fast relief. However, there is a major catch regarding your sexual mechanics. Because the upper channel is now wide open, your semen takes the path of least resistance backward. This is called retrograde ejaculation. You will still experience a fantastic physical climax, but you shoot blanks. Fortunately, because the delicate erection nerves sit on the outside of the capsule, firmness remains mostly unaffected. Now we must enter the third door. What happens when cancer requires the entire prostate to be removed? In a radical prostatectomy, doctors cannot just scoop the center. The whole gland and the fluid factories must completely go. Today, over 85% of these surgeries use Vinci robotic assistance for extreme precision. Sight 1. The surgeon controls robotic arms with 10 times magnification, working like a master watchmaker on microscopic parts. Remember our tiny nerve friends? They are glued to the outer capsule of the diseased prostate gland. The robotic arms try to carefully peel these fragile yellow cables away, performing a nerve-sparing surgery. But if the cancer has spread through the wall, the surgeon must remove the nerves to save your life. Survival is always the absolute priority. Defeating the cancer is the greatest victory you can possibly achieve. Without these nerves, the electrical signal for a natural erection cannot travel. The bridge is permanently out. Furthermore, because the seminal vesicles are removed with the prostate, there is no seminal fluid produced whatsoever. Your climaxes will be completely dry, but neurologically, the intense pleasure generated in the brain remains untouched. If nerves are spared, erectile function recovers in up to 80% of cases depending on age. Sight 1. However, even perfectly spared nerves experience trauma. They fall into a deep sleep due to surgical shock. Many men panic when nothing works on day one, but nerve tissue heals incredibly slowly, taking many months. You cannot just sit and wait for them to wake up. It is time to enter penile rehabilitation. In urology, we have a very famous and crucial saying regarding your sexual health: use it or lose it. Before surgery, your brain acted like a dedicated night shift manager, scheduling routine maintenance while you slept. It routinely pumped oxygen-rich blood into the pelvic area to keep the tissues healthy and incredibly flexible. In fact, a healthy man typically experiences 3 to 5 erections every single night without even knowing it. But with the nerves and surgical shock, this vital night shift delivery service completely shuts down. Without regular expansion, the tissue suffers from hypoxia, which is a medical term for severe oxygen starvation. If left ignored, this soft tissue slowly dries out, turning into hard, inflexible scar tissue called fibrosis. This is exactly why penile rehabilitation is crucial. It is essentially vital physical therapy for your delicate plumbing. The very first line of defense usually involves daily medications known scientifically as PDE5 inhibitors, like Cialis. These pills do not magically create arousal. Instead, they act like traffic cops, opening the blood highways. However, these pills require the delicate nerves to be at least partially awake to send the initial spark. If the nerves are still deeply asleep, the pills might fail completely at first, causing immense, heartbreaking frustration. That is when doctors introduce the vacuum erection device, a mechanical pump that requires zero nerve function. It safely creates a vacuum, physically drawing oxygen-rich blood into the tissue preventing scarring and preserving flexibility. The entire goal of rehabilitation is simply keeping the plumbing healthy until the sleeping nerves finally awaken. Consider a patient named John. 8 months after his surgery, pills and vacuum pumps were still not enough. When the foundational therapies fail to work, urologists do not give up. We escalate to injection therapy. Instead of a scary needle, think of it like a tiny, painless auto-injector click pen. This medication is delivered directly into the tissue. It forces the blood vessels to open completely on command. The best part? It completely bypasses the brain and the nerves. It works even if the nerves are sleeping. According to the American Urological Association, this therapy is over 80% effective, even with severe nerve damage. Site 1. For John, this was a game changer. He regained his confidence and maintained his tissue health successfully. But what if absolutely nothing works, or the nerves were permanently removed? There is one final, definitive option. Enter the penile implant, or prosthesis. Surgeons place 2 soft, inflatable cylinders completely hidden inside the tissue. A tiny, undetectable pump is placed in the scrotum. When you want an erection, you simply press it. Fluid rushes into the cylinders, creating a firm, reliable erection that lasts exactly as long as you want. And the results? According to the Journal of Sexual Medicine, patient satisfaction rates exceed an incredible 90%. Because whether through pills, pumps, injections, or implants, the ultimate goal is restoring intimacy and a fulfilling connection. Rehabilitation is a step-by-step staircase. You start with the simplest options and climb higher only if needed. But fixing the physical plumbing is only 50% of the battle. The rest is entirely in your mind. Rebuilding your intimate life after prostate surgery is a delicate balancing act between physical and mental health. Performance anxiety is the invisible enemy. The sheer pressure to perform can instantly shut down your system. Meet cortisol, your body's primary stress hormone. When you panic about intimacy, cortisol frantically floods your brain. It acts as a literal roadblock, instantly constricting blood vessels and stopping delicate erection nerves from sending signals. Living with this worry is dangerous. Chronic cortisol elevation increases the risk of clinical depression by 40%. Site 1. This is where your partner becomes your greatest healer. By removing the expectation of performance, anxiety melts. When you focus entirely on simple closeness, your brain releases dopamine, the ultimate reward and pleasure hormone. This powerful neurochemical cocktail directly counteracts the biological stress response, physically silencing the frantic cortisol alarms. Redefining sex is crucial. True intimacy encompasses cuddling, kissing, and emotional vulnerability, which are equally vital. If panic sets in during a romantic moment, urologists and psychologists highly recommend hitting the pause button. Scientific studies prove that just 5 minutes of deep breathing reduces your cortisol levels by 23%. Site 1. By taking a 5-minute breathing break together, you synchronize your nervous systems and actively lower biological stress barriers. Once the brain feels completely safe and unpressured, it naturally allows the physical body to respond again. Only in this deeply relaxed state can those healing cavernous nerves successfully transmit their delicate electrical signals. Medicine provides the mechanical tools, but patience, open communication, and genuine emotional safety are the true engines. Before you even schedule your surgery, you must advocate for yourself. Bring every single question to your doctor. Research shows that shared decision-making between patient and surgeon increases long-term satisfaction by over 50%. Site 1. To further protect your vascular health for rehabilitation, adopt a heart-healthy Mediterranean diet rich in whole foods. A clinical study in JAMA found that optimizing cardiovascular diet reduces severe erectile dysfunction by 30%. Site 1. So let us recap. Your prostate is merely a fluid factory, not the source of your manhood. Rehabilitation requires patience and active physical therapy. You have to train your tissues just like hitting the gym. And most importantly, psychological safety with your partner is the ultimate key to unlocking your physical recovery. Surgery might alter your anatomy, but it does not diminish your worth, your desire, or your masculine spirit. There are incredible medical tools available today. Never be afraid to ask for help to rebuild your life. This video is for educational purposes only. Please consult a healthcare professional for personalized medical advice.